Hi there, Dr. Tunis Jr. here, and today I want to discuss the epidemic Americans are facing, which is hypothyroidism. Maybe you or someone you know is experiencing some hypothyroidism. The thyroid is an extremely important organ in the body. It helps regulate the metabolism of fat and how it's burned, and it's real important for children because it helps with the development of the brain and the nervous system. So if you have an underproducing thyroid, you can see many symptoms such as inability to lose weight, hair loss, constipation, cold insensitivities. And if that describes you, maybe your thyroid is just not functioning at the highest level. Now what we're finding though is that many of the suboptimal producing thyroids are as a result of a lack of iodine. Iodine is an element that was consumed in much greater quantities 20, 30 years ago, and we just don't see it in today's diet. In fact, iodine is extremely important, and it works to help stabilize the metabolism. It helps with the brain development, helps with fertility, and it helps to optimize and increase your immune system. Now, it's probably no coincidence then that due to the decrease of iodine, we've also seen an increase in prostate and breast cancer, as well as obesity in our society. So why are we having a deficiency in iodine? Well, one of the reasons is we're just not consuming enough iodine-rich foods, such as sea vegetables, such as seaweed, shellfish or fish, a decrease in the use of iodized salt, less iodide used in agriculture and environmental products, and fluoridation of the water. And this brings me to another point with the fluoridation part, is iodide belongs to a class of elements called halogens. Bromine, chlorine rather, and fluorine are all part of these halogens, and when they're chemically reduced, they become halides, which are iodide, fluoride, chloride, and bromide. Well, iodide and chloride can be used somewhat by the body, but the fluoride, as well as the bromide, are toxic and really aren't utilized by the body well. So when you're drinking all this fluorinated water, what's going on is the fluoride molecules are binding with the iodide receptors and preventing the body's ability to uptake iodine and then use it effectively in the system. So it's important that you're getting enough iodine. So how do we know if we have enough iodine? Well, there's a couple simple tests you can do. Both have a link in the blog below. One is a urine test that requires you to read the urine. But the second one is a much easier one. It's called the iodine patch test, and requires you just to go to your local drugstore and buy a little tincture of iodine. Get the one that's yellow. You don't want a clear tincture, but you're going to draw a 2x2 square on your arm, and then you're going to monitor how that square dissipates in the body. So the quicker it goes away, the more likely you need iodine. The slower it goes away, meaning the iodine is probably okay in the body. So it's a quick and easy test, and I highly recommend you do it. The reason I think you should do it is because many people that are experiencing these hypothyroid symptoms are really experiencing iodine deficiencies and not a true hypothyroidism deficiency. So you can kind of treat some of those symptoms completely natural. And the best way to do it is consuming high iodine-rich foods such as sea vegetables, i.e. seaweed. And the best ones to get is a non-conventional, organic style seaweed. And as well as you can do some supplementation. In fact, we offer an iodine supplementation in our office, and lots of patients get some amazing results just by adding a little iodine to their diet. So that might be something you may consider if you find that your iodine levels are low. What you want to be sure of is that you don't rush out and treat your thyroid with like a synthetic drug such as Synthroid, because what we're discovering is really it's not the thyroid is not underproducing due to lack of the ability to create the T3 or the T4 hormones, but they need actually the iodine to help the thyroid to produce those things naturally. And so by adding some iodine to the system, they're able to combat a lot of those hypothyroid issues, and the use of drugs isn't necessary. Now, if we find that you do need a little bit of help, or if you've been on a Synthroid or another thyroid medication for a while, you may not be able just to get away with just putting some iodine in your system. And that's something you'll have to talk with your healthcare provider. But there are some better alternatives. They're called bioidentical hormones, and they're all available, and I list them, a couple of them below. But those are great alternatives to some of the synthetic stuff out there that your body can utilize better and more efficiently. So the bottom line is, look, a lot of your symptoms, a lot of thyroid issues are just a result of an under utilization or under consumption of iodine, and simply adding iodine to your diet and possible supplementation may be enough to just boost that production. So again, test your iodine levels a day, go to the patch test, try that out, see how that does, and start living a healthier lifestyle today.